Hi, Janet. We're going to wait a minute here to see if others join us. I think we have competition from Halloween parties and football.
That's very true. Sent you an email.
I did. I saw it, and I really appreciate your comments. And if it works out that it's just us, I will be sure to answer all those.
Okay.
And I will also clarify them for everyone else. But we'll see how. I appreciate you doing all that.
I'm a little behind in getting started this week, and it was like I was reading that. I'm like, wait a minute. I'm like, I'm confused here.
Okay, I'm sorry about that. Yeah, that's it. It's on me. This is the first time this has been on Brightspace. It's also my first time teaching this course, so I am trying to realign or actually make some of the content new, and there may be some hiccups there. But as far as the due dates, but here, so we'll definitely get to those discussions.
Yeah, because I was just like, because I was like, I'm some instructors tell us that, when you need to have the discussion questions posted by.
Yeah.
And I wasn't sure. And then I was looking and I'm like, introduction, I'm writing 2 to 4 pages and it's worth 1 point.
No, it's not. No, it's what's in the syllabus. So I can bring that up real quick.
Okay. And then I guess it was just the syllabus says, so is it due at the end? Are you considering Saturday the due date or Sunday? That's what I wasn't quite sure.
Okay. Let's just hi, Amara.
Hello, I had the same questions about the due dates. Yeah,
no
I was
worries.
a little confused.
Sorry. Yeah, we're gonna clarify all that tonight. Thanks for tuning in. I realize there's a lot of other things going on this Halloween weekend. Apparently, I always thought when Halloween fell on the weekend, like that kind of freed up the rest of the week, but apparently Halloween is a never ending, at least where I am, there's endless things going on, lots of temptations. Okay, well, we'll get started, and as others jump in. So the questions so far have been about due dates. Let me just say blanket first that the due dates are not firm as far as really any of the content. It's mostly to keep you honest or on schedule for getting the pieces and parts, and also so I can provide feedback in a timely fashion. If everything comes in at the end, then we can't catch problems, like maybe you don't even have a research question. So my blanket point would be don't get too hung up on the due dates. But to answer your questions, the discussions should be turned in by the Sunday night of each week. I will update the Brightspace to make sure that they all reflect that. And then the components, so basically there's the literature review, the research plan, and then the proposal. Ideally, we're going to have a draft of at least some of the ideas of what you're going to be doing for the final draft sooner rather than later. So that's why I put some intermediate deadlines with those. But ultimately, they'll all be due at the end of class, at the end of the last week. So they're mostly to keep the flow of documents, not all log jammed at the end for me to read, but in terms of when things are due, that would be my answer. And obviously with discussions, it's more fruitful if we have active discussion as opposed to a bunch of discussions at the end. So ideally you'll do those by the Sunday night of each week. Being a grad program, and especially since we're now getting into like research and preparing you for your capstone experience or to prepare you to do research down the road, this is going to be more of a seminary kind of format, not so much about the deadlines. But it really, my hope is that each of you will set up a time to meet with me to maybe discuss some of your ideas before you get too far, just to kind of tease out what might be a good question. Next Monday, or next week's lecture, I should say, is going to include some background on how to do a literature review. This course does require that you get an extensive number of articles. It doesn't mean you have to read every article page, every page. But I think starting with a good set of articles will make it actually less tedious and actually enjoyable to, or not enjoyable, but fruitful to read articles that are really well aligned with your topic. So we're going to spend some time, hopefully one-on-one. We can do either of you, and that's all we have in attendance tonight so far. Do either of you have topics already that we can start thinking about?
No. I mean, I currently work in research, so like I have like
Oh,
so many
wow.
topics already that I'm like working on currently, but I don't want to take my PI's work. I
Oh,
would like
that's,
to use my own work.
mhm.
And I've always been passionate about what's it called? Obesity.
Oh, okay.
And also arthritis, because I myself have arthritis. And so I know being overweight can, put a strain on arthritis as well. So maybe, I don't know, maybe correlating that a little bit, maybe. I know a
Yeah,
lot of my research work or just papers in general throughout my program has been on arthritis and then obesity and diabetes. So maybe something along the lines.
yeah, that's great. May I ask what type of setting the research you're doing now is, where you're working? What type of setting?
Right now we're doing so food prescriptions, so more like food portions.
Oh, okay.
Working with restaurants and doing alternative plan menus.
Oh, neat.
Yeah, and then also we're doing well, like kind of like deliver like Hello Fresh type of programs. So we're working with other I guess not softwares, what's that word? Uh, Facilities and doing a delivery services. There we go. Delivery services and providing groceries for them. And then we create the actual recipes for
Oh,
those who
wow.
want to lose weight and also those who are diabetic, providing a diabetic easy friendly diabetic friendly meals so that also their A1C can decrease as well.
Interesting.
Yeah.
Now, is it private industry you're working for, or is it
A
for?
Kaiser.
Oh, Kaiser. Okay, they're
Yeah.
great. Kaiser's great.
Yeah, I just started with them, so I'm still learning their ins and outs. So I don't
Which
want to step on anyone's toes either if they say, hey, can I use your research for my school?
Yeah, I think we all wish we could work for Kaiser, to be honest, because they have access to so much data compared to
Yeah.
a lot of. That's a really great place for you to be, by the way. I was most recently affiliated with the University of Washington, and we had a few investigators who had kind of dual relationships with Kaiser. I think out of Oakland or Northern California, Kaiser.
Okay.
Are you in which one are you based out of?
I'm based out of the research and evaluation department. So I'm here in Pasadena,
Oh, okay.
behavioral division.
Hmm.
Yeah.
All right. Yeah, they're they're not gonna want, but they're probably used to students or people who are working there pursuing degrees and doing research. So maybe just talk to your boss about or your supervisor about the nature of the project and what would be reasonable if you went down that path. But there's also so many things you could do around, and you probably already thought about this, but around inflammation and obesity, arthritis being an example, and their relationship. And so often you'd want to start small
Mm-hmm.
and say like you suggested, and say, okay, well, what's the evidence that there's overlap? As you said, a correlation between arthritis and obesity. And it's one of those things that when surveys and big studies were done 20 years ago, I don't think anyone was thinking about links between sort of inflammatory conditions and obesity. They seemed like totally unrelated things, or at least that wasn't the mainstream understanding. And so
Yeah.
there's probably ways in which you, and this may be overly simplifying it, but ways you could just, yeah, look at what the level of evidence is about the relationship. I think the challenge would be establishing the order, having arthritis prior to obesity and vice versa, or are they concurrent onset?
Mm-hmm.
But don't forget, this is more of a proposal than actually doing the research right now. So
Okay.
if you want to get a little more ambitious and think about like, wow, if I had access, let's say, to all of Kaiser's EMR data or claims data or something, and this is the
Mm-hmm.
type of study I would do, you can go that direction for the purposes of this course. And then if you wanted to turn that into a capstone, you already have your literature review done. And then you could use maybe some other secondary analysis to do a slightly less ambitious research project. Um,
Okay.
where, I mean, honestly, that's the type of thing that you'd be required for the capstone would be more like the um, the preliminary research that you would do to establish, doing a bigger project on a bigger scale. And so,
Yeah.
it doesn't hurt to think a little more long term.
Okay.
And there's a lot, we can talk more one-on-one, but that's kind of the purpose of this Thursday night. So don't tune out, everybody. These are probably relevant for all of you. Is that there are a number of data sources that are secondary data sources that you could use to look at these as the national. I mean, there's Annie Haynes, there's the National Health Interview Survey, and some of those actually have some longitudinal follow-up. And don't forget, you're not going to do the analysis yet anyway, but
Yeah.
kind of a review of the current kind of national studies on this top, nationally representative samples. Kaiser would obviously have data specific to Kaiser, which within the US is as broad as you're going to get as far as, one insurer. But that would be the limitation of using Kaiser's data, is they don't have access to everything, right? They just have
Mm-hmm.
population. So you could say for your idea that you are going to start with a more national perspective, that would justify then, using something like Kaiser's data.
Okay. Question for week 1 assignment. So are we doing the 2 to 4 page introduction? Is that or are we turning in a topic? I think I chimed in
Yeah,
a little late on that.
sorry. As soon as possible, it would be good to know what topics you're considering.
Okay.
And maybe even just shoot me an email with, I'm thinking about doing this, and this is what I have so far, and I can provide some guides. This class is small enough that we can work it that way. If there were 300,
Okay.
then I wouldn't be doing it that way. Again, the question on due dates, they are not hard set. So I would rather everyone pick a topic that's just interesting to them and something that they could actually pursue, whether it's immediately following this course or part of the capstone, or whenever you get to the capstone or further down the road. That's really the goal here. Because we don't want you to just go through the motions of getting this done and then hating research, because it should start with, it sounds like you already have some interesting personal or just professional experience with this topic, and so roll with it. You should dig deeper. Others may have more trouble because where to start, right? We have so many health issues to deal with, and now we got COVID in the mix, and I know I don't want to talk about COVID, but I'm so
Yeah.
sick of it.
We
I
all are.
mean, anything but. No, I won't do doctor for COVID related. No, and a lot of you, I shouldn't minimize it. A lot of you are working with COVID, and I'm just saying from a, a research standpoint, uh, there's a lot of other things that we could be doing. So to answer your question about the deadlines, thanks to Janet's questions, I'm gonna double check to see what's in the syllabus and online on the learning management system. They should jive. If they don't, I'll change them. But the bottom line is that they're pretty flexible as long as everything's turned in at the end.
Alrighty, thank you.
Uh-huh. All right. Anyone else have a topic that they're considering that we could chat about?
Yeah, I've been a nurse a number of years, so it's kind of hard because I have a lot of different things and trying to focus it down. So I guess my question is, before picking a topic, so are we supposed to be picking a topic that might be our capstone project?
It could be. It could be related to your capstone, even if you're not planning on doing research per se. Let's say you are going to do an internship somewhere, or you're going to do something related.
Because I'm trying,
Or
I
maybe
haven't
it's
figured out where my,
maybe it's a setting you're interested in. It doesn't have to be.
okay. I kind of was thinking about asthma,
Okay.
because asthma, sickle cell, because I've seen a lot of that working in the emergency room and working in certain communities. I've worked in a number of different emergency rooms, so I think it's like those are the kind of things that I see as repeat type of things. That is it because of an educational standpoint, low income, or low literacy, I should say, and that, and how to improve, their care and stuff.
So yeah, you might. It's such a broad area, obviously, asthma. Right. And there's so many different populations that have different factors that lead to poor management of the disease, right? It might be education, it could be the materials are in the wrong language, or any number of reasons
Well,
why.
yeah, it's a combination. I think where
Yeah.
I've been working in is that I've been in low income African American communities where I have the huge population and like I know several years ago, God, it's more than 15 years ago, I just had experiences with losing 2 children within a week that died of asthma. And that was just very disheartening. And we really hit the community with coming into the emergency room and teaching and stuff, when to come to the emergency room, if you haven't gotten into your doctor, you were kind of, reinforcing that kind of things, because many of them couldn't get into doctor's appointments to get their refills for their albuterol. And it's like, well, when you're running low, come on in. We'd rather see you than you getting into an attack, and stuff. So.
Yeah, and there's a ton of data sources again that would touch on asthma. That I think I mentioned this in the lecture, that one of the challenges, and Everett mentioned it as well, is getting access to some of this data. So in some ways, for this proposal, it can be a little pie in the sky, like if I had access to, but there should be like real things that exist. Like if I had access to this kind of data source, I would include this. And there's not going to be time in 4 weeks to vet all the different data sources, but you might want to just make sure that it contains data on asthma. So one way to do that would be when you're looking at the literature review, or when you're doing the literature review, you're probably going to see some national data sources that are used again and again, like the National Ambulatory Medical Care Survey. There, as you start to do a search, you'll start to see which data sources are used. So that could help formulate the research plan portion, besides doing the literature review. So like, what are you going to actually study? And you could say, well, I'm going to combine these national data sources to look at predictors of you might even as focus on children, or or something
Right.
or under 20 or something, and say what are the most common factors associated with failure, like situations where you could have intervened and there was an intervention failure and they end up either
Mhm.
dying or having severe complications. Um, so we can work that out to kind of narrow it down. But I think, if that's an interest of yours, you should roll with it. There's plenty of data out there.
Mhm.
It's one of those kind of like every survey has at least some question about asthma. Um,
I guess that, or maybe even I've been have been dealing with a lot of mental health issues with youth, actually being long-term in the emergency room because you can't get them placed in services. So that's been a big thing
yeah.
prior to COVID even hitting, and then it made it worse. And the fact that you hold the youth 2 weeks in your emergency room is pretty sad.
Yeah, that's so my daughter works in acute care psychiatric
Mhm.
hospitals, adolescents, Nationwide Children's in Columbus, and it's like one of 8 facilities in the country that have that kind of capacity to deal with you and provide the like appropriate services for acute care like that. And I was shocked, I didn't know that, and it sounds like
Mhm.
that what you're describing is kind of the norm.
Well,
In a lot of areas.
it was, I don't know, because this current hospital or past hospital I just worked at, it was low income inner city Chicago. So it was in a troubled area, and we've had a huge amount of adults, but the youth were coming in huge amounts. That was unbelievable. And I've worked in other area hospitals and didn't have this volume before.
Hmm,
And this was very unique to this area where I was at. And
interesting.
it really bothers you, when you gotta hold kids that long. And
Mhm,
uh, and it's socioeconomic factors, it's a whole combination. And you see parents struggling, going, I want my kid to get help, but I can't get them the help, or
mhm.
if they've been in the system a little bit and then they get known to certain facilities, they don't take them. They get blackballed in a sense, and that's hard.
Well, for something like that, it sounds like you could maybe move more towards the qualitative study
Okay.
to do. And again, don't forget that this is part of this is just to complete the requirements of this course. And so you could
Hmm.
propose something you never actually do, but it will hopefully prompt you to possibly
Hmm.
get excited about doing it. But doing interviews with parents, interviews with youth, interviews with different stakeholders to try to understand what's going on here.
Yeah.
And it sounds like one of those things where if you were to kind of go at the ground level as opposed to the 50,000-foot view, which we get from data,
Hmm.
there's only so much we can do from data. This sounds like a very specific problem, and it is probably happening elsewhere.
Hmm.
But try to get an understanding of what are the contributing factors to this. And yeah, is it like a surge capacity issue where we're in a pandemic now and youth mental health is 2 times what it
Hmm.
was issues? There's just or are there other things that are making it? And then you could even burden for staff, burden for parents. You could do all kinds of directions as far as how our inability to handle this
Hmm.
population adequately.
All righty. I'll talk more with you on one-to-one then. Thank you.
Awesome. Yeah, this would be a great topic. And it's a timely topic too. There's a
Hmm.
lot of interest in mental health. So whichever route you want to go, whatever you're most passionate about. And it sounds like you have I find that research often starts with an experience or something like that that kind of motivates you to want to learn more. Um, I know when my mother had surgery, for her
Evening,
camp.
Sarah.
I'm sorry?
Good evening. I
Oh,
am
good
Zara Alwarshan.
Oh, nice. I'm glad you could join us. Thank you.
You.
We were just kind of brainstorming about different topics, or not brainstorming, but just kind of sharing different topic ideas for research projects.
Okay, I have a couple of questions in the end of the session, if you don't mind, please.
Sure, no problem.
Thank you.
Did anyone else want to talk about research topics that they're considering that we can just kind of chat about? And others can chime in too about these things. I don't want to take over.
I have a topic I'm unsure of if it will work, but I've considered thinking about it for my capstone as well. I've recently started a job where I work with Medi-Cal as like the main insurance company, and there's just a lot of discrepancies and weaknesses in the whole Medi-Cal program, with providers, access to care, quality of care, actually billing with Medi-Cal. It's terrible. I don't know if that's something that can be researched, what it would even really like fall under, like if it'd be qualitative or quantitative, because there's, I mean, obviously numbers, right? With there's like people insured and people not even receiving care and that kind of stuff, but then the quality of care could be under qualitative. So I'm not really sure if that is even a good topic
Well,
to potentially do.
yeah, I guess I'm glad you brought up this question because it does start to feel more like evaluation than research when you're talking
Okay.
about a specific, I don't want to say a bad player, but a specific organization that you want to research.
Yeah.
But if you think that it is somehow representative of some new trend, maybe there's something that was brought about because of economic forces or other factors, and if there are similar, if it was more like a case study representative of other systems, then it's definitely research.
Okay.
But and it's fine if it does move a little towards the evaluation. The distinction between research and evaluation is pretty subtle because you can often think about ways that evaluation could lead to generalizable knowledge. So I think the difficulty would be you obviously wouldn't want to name the place in the study. Unless, I mean, you could, I suppose. I'm just trying to think. I mean, we wouldn't want to like isolate a single clinic and talk about how they're performing as part of a research project, but you could say for a state-funded, and I'm sorry, I'm not that familiar with that system. I don't live in California, but you know, you can anonymize it a little bit and just say for a Western state with public insurance system, these are the issues that we're facing. So I don't want to discourage you from, no, it definitely is a valid topic. Do you think you have access to, what would be your access to information?
That's what I don't know. So, I mean, other than myself, I work with a Medi-Cal provider who is amazing, and other Medi-Cal providers who are not amazing, and seeing the differences in patients and treatment, and their health, I mean, directly being affected. It would be hard to probably not like name Medi-Cal. Like I could obviously avoid like specific people and places I work, but yeah, it may just not be doable. It's just something that I've firsthand seen now, and I'm just wondering if there is research out there that shows it is a program that needs to be enhanced, or so it may just be something that isn't doable. But okay.
Well, so can you tell me a little bit more about that program? Is it California's version of Medicaid?
Yes.
Okay, so you have right now, it sounds like mostly professional / personal experience with this. You've not like read research about this yet, right?
Correct.
You could So some of those things you mentioned about quality of care received, there are data sources where you could compare differences in treatment for a specific condition based on insurance status, for example. So
Like
one,
different insurance companies?
well, or just classification of insurance. So are those who are privately insured versus public insurance receiving the
Okay.
standard of care? So one example of a study that I actually recently worked on was looking at just that issue. These were women who presented with miscarriage to the emergency department and how many of them received standard of care treatment for that miscarriage, depending on their insurance type, where they presented, etc. And not surprisingly, there were huge differences. It was kind of one of those,
Okay.
hey, we kind of knew it and we found a data source to do that. So there, you would take your experience from this one system and say, is there a signal in the data that suggests that this is more than just this one place? There are huge gaps in how patients are treated and quality of care, and you could pick some illness for which there's a fairly clear standard of care, like some diseases it's more patient preference or something like that, but we're like, okay, it's pretty clear this is what should happen, and see if that's happening.
Okay.
So and there's a couple of data sources I can think of off the top of my head: National Ambulatory Healthcare Survey, a few others that do collect insurance type, and that would be a starting point. And that just, again, with research, you often don't get to do exactly what you want to do at first because it's just the access to information limits it, but then it justifies you doing something more intensive or to try to gain access to information.
Yeah,
Say,
for
hey, this is
sure.
what's happening nationally. Let's see if this is happening within our system. How do we compare it to, we more like the private insurers, or we more like, Medicaid population?
All right. Yeah, I'll think about it. I feel like it might be a tough subject to do. It's just something I've become recently really interested in. But I might have to go another way just because it might be hard to find enough data. But I think what you mentioned might be a good place to start. So I appreciate it.
Sure. And just don't forget that you can always do a qualitative proposal where you're doing maybe key interviews with people. You could, see if
Okay.
there's people who is willing to speak with you about this. And that, that's not necessarily an easy thing to get, or I don't know what your response rate would be, but you could get survey responses from practitioners who work in the system to identify key problems. Again, this is a proposal. If it doesn't happen, that's okay. But it can get you thinking about how would you go about even at, how would you go about it? And that's always a challenge. Like there's some really important questions, but how would you actually turn that into a methodology?
So that's the main project, right, of this entire course then, is just to basically propose how we would conduct this type of study, not to like fully do one, right? I mean, that's the capstone, right?
I can't even get a study
okay.
done in a year.
I'm like, in 4 weeks, that would be crazy.
No.
Okay. Okay, awesome. Thank you. I appreciate it.
4 weeks is, in some research worlds, that's like one meeting.
Yeah, exactly. That's what I was
Uh,
like, I just wanted to clarify when I was reading the assignments, I was like, oh my goodness, I hope. Okay, so,
no,
okay,
just a
thank you.
proposal.
Okay, that's great.
So do others, thanks everyone for joining. I realize there's a lot of priorities shifting around this week with Halloween, picking out Halloween costumes, etc. Whether it's for you or for your children or whatever. But there's a good number of you on now. So are there other, while we're on this topic of picking a topic, are there any other folks who want to share what they're thinking about? And no pressure. I just, if you want to.
I was thinking about cervical cancer and how like women of color are more affected, and Black women specifically are more likely, 77% more likely to die of cervical cancer due to like lack of testing and follow-up and things of that sort.
Sounds like a great topic. Do you know what kind of research already exists? Have you started to dig in? It sounds
No,
like you have an idea. It sounds like screening is a big issue. Is it?
I don't really have any idea of like sources right now or like research that already exists. But yeah, that's what it was just. It's just kind of an idea for right now.
Yeah. I do actually know a few folks at UW who are very interested in similar topics and doing research in that area, not necessarily just cervical cancer, but other cancers, and kind of this trying to figure out, are people caught at a different stage and therefore it's, you know, the outcomes are worse, or are there other factors have to do with treatment and other things? And so that becomes sort of more like a research question, you know, is it staging? If you adjust for staging, does that explain the difference, or is there a residual difference to explain? And that would be enough to say, like, what proportion does staging explain? And you wouldn't necessarily have to measure or determine all those things that do cause it, but just how much can be explained just by staging alone. But there's got to be a lot of literature out there on that topic. So it's a good one in the sense that should find plenty of papers to do your literature review, and maybe you could then see kind of what direction the questions are heading, and like what we still need to know about that.
Okay. Thank you.
Sure. Is there anyone else who had a topic they wanted to just kind of throw out there for us to consider? Okay. Well, thank you for sharing that.
Sorry.
Sorry.
I'm sorry for the statement. I just need to know, you talk about the topic that for this week or for capstone?
We're talking about picking for the research proposal that's part of this course, which may or may not form a capstone. For some of you, it may. Others, this is just a course on research methods that we're writing a proposal.
Because I'm working also with the healthcare, like human health service resources with the County of San Diego. So is that one help me, or?
Do you think you have any access to data there that you can do for a capstone?
I do have access to, medical, CalFresh, like for the capstone is like the project for the capstone.
Well, so if you're gonna do a capstone where you currently work, you'll need to get some sort of authorization from your supervisors that you are going to be able to access things for the purposes of
course,
the course. And there may be, they give you a limited data set to identify it or something like that.
I work also with the clinic, like 2 years ago, I worked with the clinic, women health, children, pediatric. So is that also help?
Well, you would have difficulty getting access to the information from there. I mean, you could use whatever you learned from that experience to inform a proposal, but you can maybe what I would suggest, if you think you're going to do a capstone where you are, where you're working, and which is often
Okay.
often the easiest thing to do, is to talk with your supervisor about what would be within their own priorities,
Okay.
and would also fulfill the needs of the capstone. We can talk more offline about that if you want to just start to, and also with Tanya Lawrence, who's our capstone guru in the MPH program, you may want to set up an appointment to meet with Tanya Lawrence.
Okay.
I mean,
No
ask
problem.
her, what are the, because HHS, we're talking federal now, and so I don't know what
Yeah, it's
their rules
higher.
are. I know like the VA is really tight ship as far as
Yes.
getting access to data. So maybe the same with HHS. But that doesn't mean that you couldn't do a capstone in your location. There could be all kinds of quality improvement type projects that you could do. I mean, this course is focused on research, but there's all kinds of things that you could do that wouldn't be research that could still be on site.
Okay.
So
Okay.
don't feel like you have to necessarily, for your capstone, get access to data, which may be completely unrealistic, but you could be, do something.
Yeah, I understand. I got you.
Okay.
I have also a couple of questions regarding to the course. So can you just please at the end of the meeting?
Sure.
Thank you.
And we'll probably get to those real soon. So real quick before we get to other questions, have any of you had trouble accessing the city program and logging in? Because I definitely want to address that. You should do that as soon as possible. Anyone have any trouble?
I haven't had any trouble, but it's just the one course. It's like 18 modules, correct? It's
Okay. Yeah, I think it's the well, let me show you real quick. That's just in case. Okay, so when you go into city, the first thing you're going to want to do is register. And you probably all figured this out already. But anytime you, am I sharing the screen? Wait a second. Okay. You're going to affiliate with National. Oh. And then you agree to all the thingies. And then you affirm your affiliation. Okay, and at that point, you will just fill in all your information and you'll give it your email address, and then you'll set a password, and then you'll have your own account. Okay, so setting up an account, make sure you only do it once because it only wants you to use your email once. But once you've done that, then you're gonna log in and be sure to remember your username. You can request that it you can request, password resets really easily on here, I noticed. You don't have to like call somebody. Okay. And then you'll notice that you can go to view courses. And I am not enrolled. This might look a little different than yours only because, okay, yeah. So you're gonna wanna do the researchers, social and behavioral research focus only, okay? You're not gonna do the biomedical or IOB members or course instructors, just the researchers, social behavioral focus. And let's see if I click through on this. I'm gonna pretend I'm a student. So probably backfire on me, but I'm just gonna do that. I already did the training, so we'll see what it does. This time. No, I don't have conflicts of interest. Okay, so researchers, biomedical, oh no. Sorry. So I'm just going to the agreement. Sorry, I'm on a laptop. This is driving me crazy. Okay, looks like basics of health privacy issues for students and instructors, basics of information security, part 1. Yep, those are the ones. Did you have a different list? I hope not.
Let me see.
Yeah, mine has a different list.
Okay.
Yeah, I had something completely different as well.
Okay,
Yeah,
I'm
mine
glad-
was like if you go back, it's like the one that says the focus. Like we didn't. It told us on the informational sheet to not click on student IPS.
Oh, okay. Sorry.
Yeah.
Of courses. Oh. Oh, okay. This is the one you want. Okay, maybe it's because I was pretending to be a student that it did that. Let me try that. There we go. Sorry, folks.
Yeah,
I
it was
didn't
the
think
18 module one
Yeah,
is what I have. I don't know
Yeah.
if anybody else does.
yes, that's it.
That's
Okay,
the
Yeah,
one I
I
have
have the
as well.
same. Yeah.
yes. Okay, here we go. Yeah, 0 of 18 modules complete. Thank you. That'll teach me for pretending to be a student. Okay, Belmont report and its principles, students in research, history of the ethical principles, defining research with human subjects, federal regulations, assessing risk, informed consent. Okay, yep, all 18. And as I mentioned in the lecture, it really is, this is not like when you go to a new job and you have to watch the training videos. And you're like, yeah, I know not to stack stuff on the top shelf too high. And you're like, blah, blah, blah. Like, this is really important. And this is very well done. And so it is a long process, but you will undoubtedly, if you do any research throughout your career, will be asked to do this training or show proof of this training. And so it's a nice resource that you guys have access to this. At my previous university, which had more undergrad than grad, they didn't justify having a city module, and it was a real hindrance because us as faculty ended up having to affiliate with other universities that did, just so we could get our IRB or just get our ethics training renewed. And so it's definitely something that's a nice thing. You can carry it forward with you once you've done it. And if you get asked to do involved in a research project later in your career, at least within the next few years, you'll have the certificate and you can, it's transferable and you can actually change the affiliation of that certificate. So it can actually reflect the institution name that you're working for at the time. It won't have to say National University on it later. So for those of you who work in healthcare, especially some of the HIPAA stuff will be old news, but especially some of the stuff early, kind of the history of ethics is really interesting if you've not been exposed to it. Some of the landmark studies that led to our rethinking of ethics. I don't know if any of you saw the movie, The Stanford Prison Experiment, which is a perfect scene by scene reenactment of what happened during the Stanford Prison Experiment. I don't know if it's on any of the streaming sources right now, but if you want an eye-opening case study in what not to do in social and behavioral research, watch the Stanford Prison Experiment. The basic idea of it was seeing what happens to the dynamic between guards and prisoners. And the research question was, is it the people or is it the situation that leads to the dynamics that were happening in the prison system? And so the research question was probably valid or was valid, but the methodology was not. And so that's a very eye-opening one. And there's other obviously famous examples that are probably brought up in some of these documents, but it's really eye-opening, and it's really something important to keep in the forefront as you're doing research, to think about the participants or the patients first. And I know you all know that, but it's easy to kind of get caught up on our own abstractions about research, and these are real people. Okay, so that's all I wanted to make sure, is that you all could access this, and then when you're done, you'll get a certificate, and then you'll just upload that into the assignment as proof that you did it. Okay, so, all right, let's open the floor to general questions. Now, we started off our discussion at the beginning of the hour with some talk about deadlines, and I know there was some inconsistency between the syllabus and what is listed on the learning management system. The message that I said was, for the global message is everything's due at the end of the course. However, the intermediate deadlines are to keep you on schedule and to get some feedback. And ideally, you'll at least share with me by email what your research topic is going to be, just so I can kind of keep pace with you and make sure that it's something that's going to be manageable before you start digging in too deeply. I'm not going to be a gatekeeper. You can research whatever you want, but the sooner the better as far as coming up with a topic. Keep in mind, this can be for a future research project. This can just be an exercise. So that's what we talked about before. Discussion posts ideally will be done by the Sunday night of each week that they're posted. That way we can actually have a discussion. And then you got my note about quizzes. I really apologize about that. It turns out there was a disconnect between mapping to the course and mapping to the CEF accreditation things that kind of tripped a couple of you up. So thank you to the two of you who pointed that out. And I corrected that quiz. I'm making sure that quiz 2 and 3 and 4 don't have that problem as well. So, okay, questions?
I have a quick question. I saw that we have 2 SAS assignments, but I only see 1 on Brightspace.
Okay,
I only see it on week 3,
week 3.
but on the gradebook I see 2.
Okay, let me look at this real quick.
Okay.
Just so I don't, I was trying to get rid of the SAS assignments, but
I mean, even better.
You can totally do that.
Yeah.
okay. I hear multiple votes, including one for me. No, my intention was to get, and actually if you look at the syllabus, there's no mention of SAS assignments, or at least there shouldn't be in terms of the grade. So I apologize if there was a ghost of SAS lingering in there. I will delete that.
Awesome. Thank you.
Yeah. I don't know how you would use SAS for this course.
And
Honestly.
I was a bit confused too. I was gonna be like, do we have access to that again?
No, you're like, it's a never-ending nightmare. No, yeah, SAS is out. I mean, for this course.
Okay, got it.
I didn't just declare SAS over. SAS is over. I'm a big Stata fan though, so I'm not like too hung up on SAS, but no, it's I don't see any need for it in this course at all. So. Any other questions? And again, thank you all for pointing out any inconsistencies. There's a couple of issues here, and it's all my fault, but I'm inheriting this course from someone else. And also we switched over to Brightspace. So I'm gonna make sure that everything is good. And if something seems unreasonable, just let me know and I'll fix it. Try my best to get it right. The good news is I have a lot of experience in research, so I can guide you towards actually getting to be able to do research. Any other questions about the course?
Hello.
Yes.
Yeah, I'm still having problem with the city program, but I want to do it at the end of the class because I think my problem is much. I don't start the courses. I register. It's giving me institution courses, affiliation, all those things. So I put the National University. I was able to log in, but the page I'm having is different from what you just showed.
Okay. I'm having a little trouble on the audio side with your question. I heard most of it, but I didn't catch it all. You're saying you did register, but then you're having trouble.
Yeah,
after-
I registered and I was able to log in. But the page I'm having is different from what you just showed.
Okay.
Yeah, I have a page showing me my name, ID number, then courses completed 0 days of membership 2. Then there's another page, welcome, Billikis, add institutional affiliation, but I've done that earlier. So I tried to do it again. It's not going. So I don't know where to.
Are you accessing on a PC or on a tablet?
PC.
PC. Okay. Well, how about this? Can you send me a screenshot of what
Okay.
the problem is you're having, and we can figure this out offline? Mostly because I'm having trouble hearing you right now. It's not your fault. We might just have a bad connection. It's just cutting in and out. But once you set up your account, you should be able to enter your username and password.
Yeah, I entered that.
And
I use
then
my-
let me do that again real quick myself and see where it takes me. Oh, great. Oh gosh, I must have password fatigue for the day. Let's see here. What happened to that? Okay, we're gonna do this offline. I'm sorry. I will I'll try to troubleshoot your problem. I'm stumbling here with the password, which is not cool. I'll try one more time. Ah, there we go. All right, let's just say welcome, your name, and then
Yeah, it's showing my courses, my records, then my CECMES
okay.
support, that is the heading, my name. Then it's showing welcome, my name. Under it, I have add institutional affiliation,
Mhm.
registered as an independent learner.
Okay, so right, so definitely add an affiliation, and then you'll type in National University.
Yeah, I did that.
Okay.
Do I need to do it again?
And then you, well, I'm not sure. I'm trying to figure out where I went wrong.
Okay.
And then you say, I agree, I affirm, continue. Oh, I'm already affiliated. Well, that's okay. So let me go home. And then you'll want to go to view courses. Part of the problem is I may already have it active. Okay. If I do add a course though, you should then be able to do social and behavioral research focus. Don't select anything else. Ignore question 2, ignore question 3, ignore, you can say no to conflicts of interest and then click submit. And then it should say.
Is that under my courses?
Yep.
I don't have that. I have institutional courses, then add affiliation. That's what I have.
Okay. So you click on add affiliation. After you've done that, you should have National University listed here under institutional courses.
That is the problem. It's not there.
It's not
Still
there.
asking me to add. Yeah.
I'm not sure. Maybe when you did this, did you only type in national? Did you select national from the list?
Yeah, I type it and it came down from drop down and I picked national.
Okay, we may have to set up, if this persists, let's set up a little one-on-one meeting to just get you hooked up with this, because I'm having trouble visualizing what's wrong through this. So I'll let you screen share and I can walk you through it.
Okay, I'll send the description.
Okay. Well, while we're doing that, are there any other questions? Because I know we're out of time here. We're getting close to out of time.
I do have a question. So I am now in the step number 4. It asks me country of residence. I just put the USA and then may we contact you to provide information about other courses? I say yes or no.
That's up to you. I would may as well just say no if you don't want city filling up your inbox.
So no?
No,
Okay. Thank you.
you probably get enough email. Any other questions? All right, well, thank you again for taking time out of your busy schedules to meet tonight. If you have additional follow-up questions, don't hesitate to drop me an email at any time. I can answer those relatively quickly. If you want to set up an individual meeting, other than the weekends, pretty much fair game. So there's no set office hours, just by appointment for this course. So if you want to set up something for Monday or Tuesday, that's great. I know that I already have one request in, so I need to honor that one real quick, but then any other times will work. And yes.
Excuse me, I just need to talk with you after the Zoom meeting. Is that okay?
Sure.
Like I stay on Zoom or?
Mm-hmm.
Okay.
Yeah. Okay, so I'm gonna let those of you who are good to go. Anyone else who wants to stick around and ask very specific individual questions, you can stick around. So
Great. Thank you so much. Happy Halloween.
you.
Have a good
Happy
weekend.
Thanks,
Halloween.
Dr. Cook.
Bye.
Yeah.
Bye.
Okay, we'll see
I'd like
you.
to stay to get my issue result.
Yeah, of course.
I'll send the information.
Okay, let me we'll start with this. This is definitely the more time urgent because it does take a minute to get this set up. So let's see here. Sorry, I'm checking. Sarah, did you send an email?
Me?
Oh, or who, I'm sorry, who is it that has having the problem? I don't see faces, so it's a little hard for me to tell who's speaking. Was it Billicus? You're muted. Okay, well, all right, I'm gonna start from the beginning here, on the city page. Just so we're all, and I'm actually gonna log myself out here and then log back in.
Do we have to use our school email address or can we use our
Oh,
personal
yeah,
email?
absolutely, use your school email because our relationship is by subscription. And so it's looking for that nu.edu to verify your affiliation.
Okay.
You can put a secondary email in there. I don't know to what end. I think that's like if you need to do like a password retrieve or something. Okay, so I'm gonna go all the way back out here real quick. Pretend like I was never here. As best I can. They know who I am though at this point.
I send the screenshot.
Okay, so I'm gonna go and, oh, you did by email?
Yeah, email.
Okay.
So we have to use the school email, right? I use my Yahoo mail. Maybe that is where the problem is.
Let's see here. Sorry, folks, I'm working on a laptop here. I'm trying to juggle screens. Oh, I need to get a proper PC, I really do. And if I have to pay for it, okay. Okay, let's see here. Sorry, folks, I'm. Okay, I see your.
Can you see it now?
Yeah, I'm seeing the. Let me look at the. So did you clicked on add affiliation?
Yes. But I use my personal mail as Yahoo mail.
Okay. Do you think that's, can
I
you,
think that's, I don't know. I don't know. It has to be school email.
I'm thinking it does. I'm thinking it does, because that's how it verifies who you are. So that might be why you're having the trouble, because that's maybe wasn't actually giving you the
Maybe.
the
But
courses.
it's not connecting me to the school at all. It's not connecting me to the school.
Yeah. I will make sure that the instructions going forward say that. I didn't realize that. Yeah, that's the only way it's going to be able to verify your affiliation. So your email. I assume you. I mean, all of you have.
So how can I correct that now? What do I do?
So you say you'll try again with your new email.
Okay. Should I register again with my school email? Okay.
Yeah.
I'll do that.
Yeah, I'm guessing that makes sense now because you probably selected it and then it didn't match it, and so it didn't populate the course list with their courses.
Right. I'll do that and get back.
I love technology.
Thanks
It's
so much.
always something. I'm sorry for not being able to understand what's going on, but it's like, hey, it worked for me. Okay.
All right. I can leave now, right?
Yeah, get out of here.
I'll try it and get back to you.
Okay, yeah, we're gonna hope for the best of that. But yeah, if not, just let me know.
All right. Thank you. Bye.
Okay, bye. Those that are left.
Sarah, I am in the step number 5.
Okay.
And there is a question regarding to at the start of your course, you will be promoted to click on CE information page. I put yes.
You don't need that. I mean, it's okay if you do, but that's for continuing education credit, unless your employer or something wants that. But I don't. That's not for this course. You don't need to do CE credits.
And if I don't click yes, it doesn't allow for me to continue the page to step 6.
Hmm.
And they say the last, if you pick yes, please check below the one type of the credit you would to earn.
Okay.
So I put
You
like
might.
only.
Can you backtrack and say you don't want to do CE?
I don't want to see.
No.
And this is help with the other like study, because I see here social work, CE credit, pharmacist.
You don't want to do any of those.
Okay. And if I did in the future?
Yeah, I mean, that would be very specific to your,
Okay.
that would be something your employer would require of you specifically, but you
Okay.
can ignore that for this course.
And it asks you about it asked me about my address. I put my home address or the national
You
university.
can put your home address. I put my home
And
address.
okay, and what the institution mean?
What was it?
Institution?
I heard institution. Was you say another?
Another, okay.
No, I just didn't know what the field was.
And they say highest degree, I put MPH.
You could just do whatever your undergrad was. BA, BS.
Like bachelor.
Yeah, because right now, yeah.
And what about the role? ROL?
Student.
Student, okay. Student undergraduate research undergraduated or student research graduated level?
What were the options again?
The role, ROLE. There is student research graduated level and students research ungraduated.
Oh, graduate level.
And the job title?
Just put student. If it
Okay.
it shouldn't ask you for a job title if you're a student, but if it does, just put student.
And how we did learn about the city? I just put college.
Yeah, I was
Conference
forced to
meeting.
do it. I was kidding.
Okay.
Course requirement, you could say.
Okay. Sarah, for me, I would just like to let you know that this is my first time like working online.
Oh, okay.
And it's very, very hard to me. So I need like extra time to return my homework or exam, please, because I work a full-time job and I'm mom for 3 kids,
I
and
fully understand.
crazy 3 kids, and a busy husband. So please, I need extra time.
Not a problem. I don't know when you tuned in, but basically everything's due at the end of the semester, end of the 4 weeks. So the only reason that I need things sooner is that I can provide feedback, but it can be a draft. It doesn't have to be finished. You know, if you're not comfortable with something that you have, don't upload it and submit it.
Okay.
You
Can
send
I
me a
like
draft and I
send
can
you? Okay.
tell you if that looks good, and then. But you also don't have to do that. I'm just saying if you aren't sure about whether it meets the requirements.
Okay. Thank you very much. And your email is in the I have your email. So everything I can like contact you with the email, right?
Mhm.
Okay. Thank you very much.
Thank you.
I appreciate your help.
You're welcome.
Have a good night.
You too. Janet,
Thank you.
did you have?
I just finished the CD while I was listening to you guys. I got logged in real quick. Okay, so the first thing that we need to do is this intro. So it's taking a research topic and developing the first part of it.
Mhm.
Is that what I'm understanding the right way on this?
Yeah. I need to plug in real quick here. Sorry.
Okay.
Okay. So I'm sorry. Well, can you repeat the question?
I guess the first question, this paper that's due, the first one that's due
Mm-hmm.
is the one that's for this introduction that says 2 to 4 pages.
Mm-hmm.
And then we just develop that part of it, correct?
Correct.
Okay. And then, because there was one part that says doing, oh, my computer just decided to go wacky here. It decided to add another. Okay. How is it? Do we have to, for the discussions, do we need to have a reference at all?
No, I mean, no,
Okay.
unless
Okay.
you think it is appropriate, but it's not required.
Okay, just, I had come so close to finishing a master's program that was for nursing for clinical nurse specialist, and I got so used to it, and then all the classes I've gotten so used to doing it. That's why I'm asking, because
Yeah, no, I mean,
Everybody-
if you're trying to make it like a argument with someone over a topic, and you want to say, hey, according to
right. then
Smith
you
and
do it. Okay,
Jones, 2005, I mean, obviously it adds weight to your argument, but it's not required.
okay. And so we're not doing SAS, correct? We're gonna,
Correct.
we don't,
I will remove any mention of SAS.
I don't know. I was getting ready to start it and I was like, wait a minute, there's only week 3 here. Where's week 1? And so I was like going, So like I'm for the introduction, if I go ahead and choose that behavioral health one, since it's a little bit different than the asthma, that would be more
Oh, yeah.
looking at like youth under 18 for mental health and their delaying care.
Yeah, like how, I mean, I think at this point, documenting what a problem this is. I mean, these are kids who are just needing,
Yeah, it's
some sort of
getting to be that way.
evaluation, and they're ending up in this cycle.
Yeah, it's unbelievable. It just blows my mind.
Mhm.
This last job that I was at, I was the ER manager and walked into a hot pan mess of things.
So what part of Chicago is it?
Actually Inglewood. It's the south.
No, I used to live in Hyde Park, right next door.
Oh, okay. St. Bernard's.
I know Englewood pretty well. I used to pick up the L in Englewood. Back in
Yes.
the day. Yeah, murder capital of Chicago.
Yes. And it was on Lark that I got this job. I had been out of work for a year after my heart attack from pericarditis. And I was looking for a more setback, things that I wouldn't have to. And I got this blind call one day from their HR director going, I found your resume on Indeed. Would you like to come interview for our nurse manager position?
You Google Englewood? No, I mean,
I did.
it's a high need. It's always had high need. And I unfortunately in Chicago, I was there in the 90s.
Okay.
And that was during the peak of the original homicide epidemic in Chicago. But now there's so many neighborhoods, even moving out towards like Oak Park and things now.
Yeah, everything is just, it's off the beaten path. I mean, the amount of shootings that are going on the expressways is,
It's terrifying.
I'm like, what's going on? And this has, as I started working in Inglewood, and I was there for a year and a half, and it was like, what's going on? You know, and it wasn't just along that strip on the Dan Ryan there, along
Mhm.
that area from University of Chicago, and that, and it's like going to the western suburbs. I'm like, what? It's just not, I can't figure it out. It blows my
Mhm.
mind away. And when you say the 90s, I got that, because that was, I had started as a nurse in 85.
Mm.
Okay. And that was about the time things were creeping up, and you were seeing a lot of the shootings, and then it finally died down. And I think it was that, work of Jesse Jackson and
Mhm.
Farrakhan and all of them who got together and really pulled things together, and it was gang related. But
Mhm.
it makes me wonder, because they're not calling it out as gang related at this point still, but
Mhm.
how much is it gang related and nobody's tapping in, and it's just this constant fighting,
Yeah, it's definitely retaliatory still. It's definitely like,
Right.
yeah, whether it's gang or not, which, whew,
Yeah,
yeah.
it's
I mean, it breaks my heart because I love Chicago.
mhm.
Uh, it doesn't feel, I mean, and if you're on the Magnificent Mile, it feels safe enough, but then, yeah, you go to some of these neighborhoods and it's another world.
But you know what? They're even saying a lot of, after the George Floyd and all the rioting that was going on, we had some of it,
Mhm.
but it's still just not, too much is starting to happen in other neighborhoods that things weren't happening.
Mhm. Well,
And
now you're starting to deal with all the economic hardship on top of
right.
from COVID. That's what's, I think, precipitating on boredom, honestly. Like there's people who are just like,
Well, I know the Dan Ryan, it felt like this, the Indy 500 there for a while during COVID.
oh
People were
yeah.
just driving crazy. And I was coming and going to work, and I'm like, all right, I know I can drive. I have a lead foot to a certain extent, but I'm like, man, people, you all are blowing past me. And
I know that was happening in Seattle too. I was calling it Mad Max, but yeah, same thing where it's just like, what is going on with the roads? And I think until we get back to normal, people are just going to take advantage of the fact that it's.
well, people, it's the roads are getting busier around here. Where do you live now?
I'm in Seattle.
Okay. Yeah, it's just, I don't know. And jobs, people, I don't know out by you, but like just for McDonald's and the fast foods, they're closing early because they don't have staff.
Yeah, it's happening here too.
And it's like crazy. And I'm trying to find a job again because I got let go
Hmm.
because I got COVID, and I've had some long hauler symptoms going on, and I had some restrictions, and they're like, well, you can't come back to work with restrictions. And I was off the 12 weeks worth family leave, and they fired me.
Oh, I'm sorry.
So I've been
Yeah.
looking for a job and finally starting to feel better, where I can feel like I can head back into school a little bit. Because
Well,
I
I'm glad you're
stopped.
recovering. It seems like it's a slow process for some folks. It's.
I had started it when I was off after my heart attack, and was doing well. And then when I decided to take this job, I'm like, let's just do the new job and don't worry
Mhm.
about grad school, because that's going to be too much. And then I've been off again. So it's like, okay. And I had started to take classes back in January and was doing all right. But then with some of my long hauler symptoms, if I was reading, I get dizzy.
Mm,
And it's like, this is crazy, or watch TV, and it's been,
yeah, studying's hard enough when you're
Yeah.
feeling well, when you
right,
have your full senses. Yeah, no, it's
okay.
um.
So this assignment is worth 100 points?
Mhm.
Okay, because it says 1 on the,
Yeah, that. I apologize. That's just the default on the program. It wasn't
Okay.
actually entered by anyone, so I
All
will
right.
make sure that.
And so the last paper, is that worth 40% of our grade? Is it weighted?
Let me double check that.
Because on the thing for the thing, it says 40%, and I was like, wait, I didn't see anything
Let's see.
that was saying it, that was, things were differently weighted,
Let me double check. Sorry.
Maybe it's on the syllabus that says
Yeah.
40%.
Looking at it now, you probably can't see what I'm looking at, but I'm looking
Yeah,
at
no, it does say instructions. Upload your final research here by Saturday at 11:59 week 4. This is worth 40% of your final grade.
Oh. No, it shouldn't have. It says that, but it shouldn't, because combine the research proposal, literature review, the research methods assignment, the final research proposal, those are each 100 points.
Mhm.
So the final research proposal paper is 100 points. That's only 1/4 of the total. That's 25%.
Mhm.
So no one piece is more than 25%.
Okay. All right, so this last one means that we're putting everything that we did originally, the introduction, the methods and that, right?
Yeah.
Okay.
Yeah, I'll have to look at the link. Let's see here.
They've got them. Because I didn't know what we're doing this research proposal. I guess I wasn't sure, was it just to get the fundamentals of doing it?
Yeah.
Or was it to actually writing it, that it's your capstone project possibly? Because I guess that's what I didn't understand,
Both. For some students who want to do research for their capstone, this can form the basis. You're already halfway there because you've done lit review, you've thought about the question, you've identified data sources.
Mhm.
I think it's, but it's also an exercise for this course. So this course is independent of the capstone process. It's how do you go about thinking about doing a research project in public health.
Yeah, because see, I wrote a project for my clinical nurse specialist program.
Mhm.
I just never got it instituted.
It's a
Because
lot.
I did like a survey. I developed a survey of the nurses of looking at their education and then what their perceptions were about mental health, because that was when the new questions came in under triage of
Mhm,
asking people if they were suicidal or not.
mhm.
That became a mandatory question that everybody who comes through the emergency room, you have to now ask.
Mhm.
So that was
Yeah,
what
that was relatively recently, right? When they ended up.
it's been. It's probably in the last couple of years that it's been more, I think it became, but we were throwing it on just before it was like a test question. Because
Mhm.
we were talking about it, because we were having things, and so it was part of my idea for my CNS project.
I see.
So I wasn't sure, so, okay. All right.
Yeah, I have to figure out what you said. It said somewhere in the syllabus about it being 40% of your grade, or did that say that in the assignment? Because I don't remember.
This is
seeing
what
that.
I guess when I read this here for week 4, it says this is worth 40% of your final grade.
Okay, let's see here. On the syllabus, this is that?
It's on, it says on week 4 in the course, and then where was it on the syllabus?
Okay, I'll double check. That's
Because I
okay.
think on the syllabus, there's, the dates are all,
Yeah, I'll reconcile that.
yeah, because
I'll
the
send it updated.
dates, yeah, because it's kind of,
Thanks for bringing that to my attention. I saw your list. I was like, okay.
well, you know what? And then I got thinking about it, and I thought about it because I was like, I wonder if she's one new to the university, because it's, I had one other teacher who was new one time, and it was like, when we were still on Blackboard, and you could tell because what you want and what the school is saying, and if you inherit something from somebody else, it, there's always been a,
Yeah, I'm sorry you got caught in the middle of that. I will
oh,
double check and check. But
I've learned to adapt, please. I've been a nurse, like I said, I've been a nurse too long, and I've learned to roll with things over the years, so I
Mhm.
don't,
Well, I
yeah.
appreciate you speaking up because I definitely want to make this course better, and that's one reason why I'm teaching it now is to make it better. So thank you for helping.
Yeah, because it says under here in the syllabus, weeks 1 and 3 SAS practice assignments. Work at your
Thank you.
own pace. I was like, okay, but there's only one here. You know,
Okay.
I know they've been pushing the SAS thing.
Mhm.
I don't know if that became part of that competencies and stuff, you know,
Yeah.
that they were doing. So,
Yeah.
um,
Well, I will correct it. I will do an updated syllabus that, and also
yeah. It's all right. I was just, you know, I started reading it, and when you didn't put it up, and I had Boy Scouts on Tuesday night, so I was, or no, Tuesday nights are my Boy Scout meeting, so
Oh, that's
I'm-
fun.
yeah, I'm a Scoutmaster. I inherited a troop a couple years ago. My boys are done. My boys are grown. But they both eagled, and my friend was running this troop, and he goes, "Oh, why don't you take over my troop?" And I went, "Yeah, right." And I thought he was joking. And he come back to me the next week and says, "Oh, I announced it at the district meeting, you're taking over my troop in January."
Oh gosh.
So I am now the Scoutmaster of a smaller troop over in Olympia Fields, a pretty diverse group of kids. So it's kind of really nice. And then prior to taking on to them, because I was so involved with my boys stuff, I had gotten involved on the national level
Oh
with
wow.
being just a healthcare provider at National Jamboree and the Order of Air Conference, the Honor Society, at
Mhm.
their when they have it every 2 years as part of the medical staff. So that was just
Well,
like,
good for you doing that. I feel like kids need that kind of stuff more than ever just to keep their socialization and sanity and all that through this COVID.
yeah, I got thinking about it, and I'm trying to think if I could somehow do an internship with the Boy Scouts or like with my local council
Mhm.
in identifying something, you know.
I mean, you certainly could with respect to COVID, especially the jamborees. But also maybe just, yeah, that's interesting.
Yeah, I thought about that. I was trying to think and see if I
And that would
could
be
figure out.
you know, I mean, I always recommend with students, especially at the master's level, if there's something that you're already involved with, if you could take advantage of that in some way, it's meaningful. You know, the problem there is that because you're dealing with youth, then there's a whole nother layer of
But is there stuff that I can do to address the public health issue with the adults per se?
yeah, no, you could.
That would be things, because and I guess that's what I guess that's where I'm struggling with lately. I think with the program, they have this meeting with Tanya Lawrence about your internship and that, but they're not explaining early enough, I guess, what you have to do. I guess explain it well as, you know, what you do in your internship, is that also your capstone project, or is it two separate things completely?
No, it should be the same thing. Yeah.
Okay,
Yeah. Yeah, you would do a capstone with respect to an internship.
okay. And that's what I guess I wasn't, and maybe I'm just foggy with my COVID,
No, it's,
because when I started this here at National, they were, uh, accreditation was there, but it was only good for a thing. And then I know they've been making changes, so I've been in that flux of,
yeah, yeah. No, I understand, and since I'm not relatively new, I'm unfortunately not the best to ask about capstone at this point. I'm hoping to learn more as I go
Mhm.
that one, but having gone through a capstone myself, I know that that is one of the more intimidating parts of any master's program.
Mhm.
Some have thesis, some have capstone, it's ultimately it's up to the student to find something, and that's what's intimidating, but there's a lot of wiggle room as far as what you can do. So
Mhm.
we're pretty flexible on the the, the content. It's mostly just making sure that, especially if you're working with an organization like the Boy Scouts or something, that you have kind of what's called a site preceptor, or the person who is
Mhm.
aware of what you're doing, and then there's sign off there. And so that's something that Tanya can help with.
Yeah, I don't know, the Boy Scouts might be hard, but I might be getting back at one of the hospitals that I worked with. One of the Catholic hospitals,
Mhm.
Franciscan, I don't know when you left the area, that over here in Indiana.
Oh, okay.
I live on the border.
Oh, okay.
I grew up as a South Side girl in the suburbs of Chicago. I grew up in Calumet City.
Oh,
And
okay.
then I just migrated over to a little bit further south out to Crown Point. Now I'm in Munster. So,
Okay, I know those areas. Yeah, I've lived in Hyde Park, Bridgeport, and I was also in Elkhart, Indiana for a while.
oh, okay.
Long time ago. Yes. Are there a lot of Mennonites where you are, or you're not quite to that part of Indiana?
I'm not that far. No,
Okay.
I'm right on the border. Munster is like right on the border of Illinois, Indiana.
Okay,
And
so
then
you're like still
Northwest.
like Chicagoland there.
Yeah. Uh-huh. And because everybody's like, where's that? And I'm like, oh, just south of the city. And and it's like, and because of the things that have been going on with my health and losing my job, I wound up on the Indiana Medicaid. And I've been down in Indianapolis because that's where they're only giving me the best answers to
Oh,
everything
wow.
that's been going on. So
Okay.
I've been traveling to Indianapolis like every 2 weeks for 2 days. And it's like, so it's been a wild whirlwind, I'll tell you.
Yeah.
And so I wasn't sure of, I was like, do I want to? And I thought about challenging, well, I could transfer the credit because I had taken research in my other master's program. And I thought,
Mhm.
no, let me just retake it. It's been a few years, and every teacher teaches differently. And the teacher I had for it originally, she's a psych CNS and deals with a lot of mental health of younger kids, but she's also a nurse herbalist.
Mm.
So a very, and she taught very differently, and everybody was always freaked out by her.
Well, yeah, I think there's so many. I think we need, though, people like that to kind of stir up the pot a little bit as far as how we approach research. Some of these, especially in the areas like mental health, we're making so little progress that, hey, let's try it.
Well, unfortunately, is for as bad as COVID is, I really feel it has brought light public health. It has brought light to mental illness
Mhm.
in general, that people weren't, they always thought of it as something. They didn't see it as another part of being a physical problem, even though it's mental, but it is a health issue, and people they think it's the bad of it all the time. And I think with Simone Biles and the Olympics and a couple of the other things that, and COVID has brought a huge light to it, I think, and more people are accepting of it and not
Yeah.
frowning at it as readily.
Well, I've even noticed over the last 10 years that I used to work mostly with undergrads, but how much more students have become open about talking about it, just within 10 years. It's wonderful, because I know when I was an undergrad, it was something to feel shame about, if even if you had it in your family, let alone you.
Yeah.
I
And I think,
remember trying to hide. My dad had severe depression, and I remember just not ever wanting to bring that topic up. And now we're to the point where students will talk about themselves. I'm like, wow, that's that's wonderful that kids feel that way.
it is. I think there's a lot to it, and it's just mental health is just like having diabetes. It's just like having hypertension. It's just another facet of your health, and we need to address it. And it's been shoved under the carpet way too long. And
Well, and I think, I'm also learning how it can affect, like you said, with Simone Biles and some other prominent athletes who've come out. That one, the NBA player, Kevin Love, with his panic disorder. And there's a whole variety of things that they've identified as having. And so, yeah, the more it can be normalized and destigmatized, I just hope it provides some hopeful messages too, that they can get these, some of those disorders can be treated pretty easily, or relatively easily.
And I don't know, when you were here in Chicago, and I guess I never realized, and I've worked around in a number of hospitals, but it's like when I wound up going to Inglewood and working at St. Bernard's, when I walked in there, they were actually we built a 14-bed, part of my emergency room was 14-bed locked unit to deal with adult mental health, because we weren't, to admit them either to our hospital or to send them to one of the state facilities or to another institution. But since most of those people didn't have private insurance at all, but I'm like, why is it that I've got that many? Is it because of the drug abuse? Is it the violence that's triggering so much? And then it was the amount of kids. I mean, there was a couple weeks that I had like 2 and 3 kids a day in the emergency room, and having them for 3-4 days. And then I had in 6 months, I had like 2 or 3 kids that were there like a week and a half to 2 weeks, 3 weeks, sitting in the ER because I couldn't get them placed.
That's crazy.
And I even had a parole officer say to me, well, just let them go. They'll get picked up. And they'll just deal. And I'm like, oh my God, this mother was crying out for help to get her daughter help. And it was like, I couldn't get her the help. It was horrible. So I got to figure out to write this. If I wanted to do something on this would be looking at the disparities of youth being in delay of care, inability to get care, is it?
Yeah, or just even, there's a lot of conditions where people are presenting to the emergency department because it's their only option is getting access to care at all. And so just even as a first step to document the extent of that problem, how much is already known, and that's where you identify gaps in literature to say, do we even know on what kind of scale it's in. It's because it can be, it's not even just a urban issue. There's rural areas where it's even worse, where there's no one to go to.
Right.
Or, there's zero options. And, thankfully, it looks like some of the telehealth stuff might help with that. At least
Mhm.
having some sort of more continuous source of care. But yeah, I think anything you can do, you can kind of think it more on the awareness kind of advocacy side, was saying, hey, we got to document this problem. There's not enough attention is being paid to it. I would say that's true of so much in mental health, right? I mean, mental health research is so grossly underfunded compared to everything else. I mean, it really bothers me sometimes going to national conferences on, heart disease and things like that. And it's always, 50,000 researchers from all over the world. And yeah, it's great. And I don't want to minimize the importance of cardiac medicine, but
Right.
like, how much research do we need compared to something like mental health, right? So there's just not the same level of funding. So any kind of background work is really needed to identify the problems that are existing. So
Okay.
if you need more guidance, just let me know. I'm personally very interested in that topic. Not that that matters, but I can.
No, I've had a very, being a nurse, you kind of wind up bouncing sometimes on topics
Mhm,
to that you focus or what you need to adjust to, and
mhm.
the asthma hit me. I was thinking about it the other day, and it was like, when you lose 2 kids under the age of 18 in a week and a half, it kind of hits home after a while, hits home, and then, but this mental health thing with the kids has bothered me a little bit. And I was like, okay, let me see what I can do. And that's why I was trying to bounce off both.
Mhm.
So, all right, well, let me look at that and start my CD program and get my questions answered. And the quizzes are due by Saturday or Sunday. That's what I meant to ask.
Sunday night, 12 o'clock midnight.
Okay, will do.
Okay.
All right, thank you so much, Dr.
All
Cook.
right.
All right, have a
Thank
great
you.
night.
I know
Uh-huh.
it's late in Chicago. Bye.
It is, you know what, I'm a night owl, unfortunately. I was one of these nurses who worked too many years of evenings and nights, and you put me on days and it's like, and then 10 o'clock at night, I get the second one.
Well, I'm just getting back from the Central Time Zone. I was in Austin over the weekend, and
Oh,
I'm all messed up.
yeah. Okay, well, have a
All right.
good night. Get
All
some
right, see
rest
ya.
too. Take care.
Thanks. Bye-bye.
Bye.